Good.
The next three tests I call the Triad. EOMs, which is extraocular muscles. Confrontation, which is notated CF. Pupils. The first one will be extraocular muscle testing. We are testing how well the eye muscles work in different gazes. For this test, you need to have your patient take off their glasses, okay? Very important so that you can fully understand and visualize how well the eye muscles are working. What we'll do, you'll have the patient look at a target. So I have a pen light. If they're younger, you can have them use a fixation stick and have them look at something, okay? The thing about this test is you have to make sure the patient does not move their head. When they move their head, the eye is perceived to have a Dahl maneuver effect, okay? This means that as you move your head, the eyes will move in a different way. So we are only testing extraocular muscles, and that requires the head to be stationary in primary gaze, okay? Now what we're gonna do is we'll say, hey, can you look at this car for me? I need you to not move your head and only move your eyes. You're gonna follow this car everywhere it goes. Now, if you do this, move your head, move your head. Do you see how they're moving their head? If a child is doing that, what you can do is gently place your hand on top of their head. Now, look at the car, move your eyes only. You're gonna go until the eyes can no longer move. Slowly bring it back, go to the other side. Sometimes you will notice endpoint nystagmus, which if you're looking all the way in extreme gaze, you might notice the eyes have a jerky movement. That is normal. That is endpoint nystagmus. We're coming slowly back, and we're gonna have the patient look up. Both eyes should go straight up. As she's looking down, we're gonna gently lift the lids up with our finger. Boop. Good job. Now, with this, we can also do a test called NPC, near point of convergence. Have the patient still look at the same shape, and now you're going to tell them, I need you to focus on this car. Let me know when it comes double, or like becomes double, or if there's anything that changes. What we're looking for is how well the eyes are able to converge together. So let's start it off. She's gonna slowly look at this, slowly look. Now at this point, the right eye is no longer converging, so we're gonna move it back and try it again. We're going to measure after 3 times if there's an eye that kicks out or kicks in, at what location does that happen? That is no longer a point of convergence. That's a point where the eye is diverging. Therefore, we have to stop and measure at that point. Right here, this right eye is slowly kicking out, and we'll do it one more time just to confirm. Convergence, convergence. There we go, the eye is diverging. Therefore, we're going to measure at the lateral canthus, move it over at 10 centimeters. 10 centimeters is considered very borderline. What we'll put in the chart is NPC 10 centimeters times 3. Now, it's very important to understand if the patient wears glasses, they must do this test with glasses. Let's pretend she doesn't wear glasses, but she does wear glasses, and therefore she should have been tested with this. But we want to show it if the patient doesn't have glasses or if they have glasses. But if they have glasses, they must do this test with glasses. It's very important. What you saw was without glasses. Now we'll show it with glasses. We'll only do it once. Follow the car. Kicks out. 10 centimeters. Exactly the same measurement. The next thing we'll do is confrontation fields. Confrontation field, the test or the purpose of it is to test their side vision. We want to make sure that when we're testing confrontation field, you are going to close one eye and have the patient only look at the open eye. They are going to only look at this open eye. If they look anywhere else, that is considered something else, not this test. We are testing their peripheral vision, their side vision. What we'll do, we'll show up a 1, a 2, or a 5. Now, Cover your left eye. Look only at my open eye here. I'm approximately 55 centimeters away from the patient. How many fingers do I have?
2.
Right now, I am testing her inferior temporal visual field.
1.
Now I am testing her superior temporal visual field.
2.
I am now testing her inferior nasal field.
1.
I am now testing her superior nasal field. All right, now we're going to switch eyes. Looking at this eye, how many fingers?
5.
Testing her her inferior temporal field.
2.
I'm testing her superior temporal field.
1.
I am now testing her inferior nasal field.
5.
I am now testing the superior nasal field. If there is a defect in one of the 4 points of fields, correct? If there are any defects in superior, inferior temporal, superior, inferior nasal, you must notate that into the computer. Therefore, if you're notating it, when you're doing confrontation fields, the notation is FTFC, full 2-finger count. You cannot put this if all 8 fields are not visible, okay? For instance, I'm testing her right eye. Cover your left eye. Looking only at my eye, if I show a 2 and she does not see it, I show a 1, she sees it. I show a 5, she sees it. I show a 2, she sees it. Therefore, on the right eye, she had a superior temporal restriction. That means that she was not able to see the upper outer field of the right eye. You cannot notate that as FTFC, which is full 2-finger count. I want to make sure that you understand that. The last one will be pupillary testing, pupils. Each person should have a pen light in each room. These little circles notate the size of the pupil. You will use this, or you will have your near visual acuity card with also the pupil circles to measure how big or small the pupil is. We're going to have the patient take their glasses off. The first test will be a direct pupillary testing. What I will do, I will turn on my light. I will start with the right eye, and I will go 1, 2, 3. 1, 2, 3. What I will notice as I shine the light, there should be a direct constriction of the pupil, meaning the pupil will get smaller immediately upon the light being shown in the eye. Left eye, 3. 1, 2, 3. Again, in both eyes, directly when light is shown, I have direct constriction, very quick. Now we will do consensual pupillary testing. Hold it, 1, 2, 3. 1, 2, 3. 1, 2, 3. As you see the pupils, they're about the same size, meaning there is no APD or afferent pupillary defect. If you shine the light into the eye and there's a big constriction of the pupil versus the other eye, you want to make sure you grab the doctor. This is very important. Next step, you want to measure the pupils. Right now we're in dim light, so we can measure it as we have it here. As we're looking at her pupils, I'm holding the card next to her eye. We measure it about a 6 in the right eye. All we're doing is just comparing apples to apples, okay? What we see versus what we have on the card. 6 OS. Now for bright light, you can do one of 2 things. You can shine the bright light and check the pupil. About a 3. Let's go to the other eye. Bright light. About a 3. This means curl up. Pupils are equal, round, reactive, responsive to light and accommodation. No APD visible. If you do not see what I just showed you, grab the doctor, please.